Hey guys, we have a few more questions for Dr. Smith. So Dr. Smith,
Yes.
turn around. How are you doing?
Doing good. Let me guess. Medical Minute?
Medical Minute. It is that time again.
Good, because we do this daily, don't we?
Yeah, we should, but that's okay. People really love it. But we have a couple of questions from a gentleman named George.
George. Hello, George.
Hopefully really short. I didn't write the questions down. Okay, the questions are: do you do just back? Do you work on just back? And do you always recommend surgery?
Good questions. We do minimally invasive surgery of the spine, including the cervical, thoracic, and lumbar spine. So it's the entire spine, probably evenly divided between the cervical and lumbar spine if you look at the number of cases. Plus, if you looked at our YouTube site, you'd see we have several patients that we've done cervical spines on that have done testimonials. We have that famous one people always talk about where the gentleman had a cervical surgery in the morning. I think we put in a new cervical disc. That was at 7 a.m. About noon, he decided to tell the nurses he wanted to go home. They took him to the front of the hospital, and somehow he wound up driving himself home, which we don't recommend, but it is, just shows you it's a very minimally invasive type procedure. Most people do go home the same day. Sometimes we'll keep people overnight, but it is minimally invasive. So yes, we do minimally invasive surgery on the cervical, thoracic, and lumbar spine. So on the neck, thoracic spine, and lower back. And what was the other question? Oh yeah. Then they asked, the second part of his question, George's question was, do we only do surgery? And that most people wind up not having surgery. They wind up responding to conservative treatment. So we do make recommendations as far as physical therapy, other types of treatment, pain management, epidural injections. So not everybody winds up with surgery, but certainly a certain percentage of people who do not respond to conservative treatment wind up having minimally invasive surgery and are very pleased, and then they go tell their friends and neighbors all about it.
So cool.
So I think that answered it. Any other questions?
Well, there's a ton of other questions. I'm sure we'll get to them in time.
I know we're running a little behind.
We're a little behind on that.
We were going to do it like, what, twice a week? I think daily to begin with.
We
and
said daily, and then
once a week, and now I think we're doing it once a month, but we'll try to do it more often. I'm sure we're way behind on questions. Please keep the questions coming in. We will catch up someday.
Yes, we will.
Yes, we will. We might. We'll never catch up. But
two good questions.
Thank you. And the most important thing is subscribe.